Question 141. A nurse in a provider's office is assessing a client who reports losing control of urine whenever she coughs, laughs, or sneezes. The client relates a history of 3 vaginal births, but no serious accidents or illnesses. Which of the following interventions are appropriate for helping to control or eliminate the client's incontinence? Select all that apply. A. Limit total daily fluid intake. B. Decrease or avoid caffeine. C. Increase the intake of calcium supplements. D. Avoid the intake of alcohol. E. Use great maneuver. Answer B and D. Explanation. Caffeine and alcohol are bladder irritants and can worsen stress incontinence. Alcohol is a bladder irritant and can worsen stress incontinence. Because stress incontinence resounds from weak pelvic muscles and other structures, limiting fluids will not resolve the problem. Calcium has no effect on stress incontinence. The Creed maneuver helps manage flex incontinence, not stress incontinence. Question 142. A client who has an indwelling catheter reports, "I need to urinate." Which of the following interventions should the nurse perform? A. Check to see whether the catheter is patent. B. Reassure the client that it is not possible for her to urinate. C. Recatheterize the bladder with a larger gauze catheter. D. Collect a urine specimen for analysis. Answer A. Explanation. Check to see whether the catheter is patent. Explanation. A clogged or kinked catheter causes the bladder to fill and stimulates the need to urinate. Reassuring the client that it's not possible to urinate is a non-therapeutic response because it diminishes the client's concern. There are less invasive approaches the nurse can take before replacing the catheter. Although it may become necessary to collect a urine specimen, there is a simpler approach the nurse can take to assess and possibly resolve the client's problem. Question 143. A provider prescribes a 24-hour urine collection for a client. Which of the following actions should the nurse take? A. Discard the first voiding. B. Keep all voidings in a container at room temperature. C. Ask the client to urinate and pour the urine into a specimen container. D. Ask the client to urinate into a toilet, stop midstream, and finish urinating into a specimen container. Answer A. Explanation. The nurse should discard the first voiding of the 24-hour urine specimen and note the time. The nurse should collect all voidings after that and keep them in a refrigerated container. For urine analysis, the nurse should ask the client to urinate and pour the urine into a specimen container. For a counter, the nurse should ask the client to urinate first into the toilet and stop midstream and finish urinating in the specimen container. Question 144. A nurse is preparing to initiate a bladder training program for a client who has a voiding disorder. Which of the following actions should the nurse take? Select all that apply. A. Establish a schedule of voiding prior to meal times. B. Have the client record voiding times. C. Gradually increase the voiding intervals. D. Remind the client to hold urine until next scheduled voiding time. E. Provide a sterile container for voiding. Answer B, C, and D. Explanation. Ask the client to keep track of voiding times is an appropriate nursing action. Gradually increasing the voiding interval is an appropriate nursing action. The client should be reminded to hold urine until the next scheduled voiding time. Bladder training involves voiding at scheduled and frequent intervals and gradually increasing these intervals to 4 hours. Meal times are not regular, and the intervals may be longer than every 4 hours. A sterile container is not used in a bladder training program. Question 145. A nurse educator on a medical unit is reviewing factors that increase the risk of urinary tract infections with a group of assistive personnel. Which of the following should be included in the review? Select all that apply. A. Having sexual intercourse on a frequent basis. B. Lowering of testosterone levels. C. Wiping from front to back. D. The location of the vagina in relation to the anus. E. Undergoing frequent catheterization. Answer A, D, and E. Explanation. Having sexual intercourse on a frequent basis is a factor that increases the risk of UTI in both males and females. The close proximity of the female urethra to the anus is a factor that increases the risk of UTIs. Undergoing frequent catheterization and the use of indwelling catheters are risk factors for UTIs. The decrease in estrogen levels during menopause increases a woman's susceptibility to UTIs. Wiping from front to back decreases a woman's risk of UTIs. Question 146. Clients should be taught that repeatedly ignoring the sensation of needing to defecate could result in which of the following: A. Constipation, B. Diarrhea, C. Incontinence, D. Hemorrhoids. Answer A. Explanation. Habitually ignoring the urge to defecate can lead to constipation through loss of the natural urge and the accumulation of feces. Diarrhea will not result if anything. There is increased opportunity for water reabsorption because the stool remains in the colon, leading to firmer stool. Ignoring the urge shows a strong voluntary sphincter, not a weak one that could result in incontinence. Hemorrhoids could only occur only if severe drying out of the stool occurs, and thus repeated need to strain to pass stool. Question 147. Which statement provides evidence that an older adult who is prone to constipation is in need of further teaching? A. I need to drink 1.5 to 2 quarts of liquid each day. B. I need to take a laxative such as milk of magnesia if I don't have a BM every day. C. If my bowel pattern changes on its own, I should call you. D. Eating my meals at regular times is likely to result in regular bowel movements. Answer B. Explanation. The standard for practice in assisting the older adults to maintain normal function of the gastrointestinal tract is regular ingestion of a well-balanced diet, adequate fluid intake, and regular exercise. If the bowel pattern is not regular with these activities, this abnormality should be reported. Stimulant laxatives can be very irritating and are not the preferred treatment for occasional constipation in older adults. In addition, a normal stool pattern for an older adult may not be daily elimination. Question 148. A client is scheduled for a colonoscopy. The nurse will provide information to the client about which type of enema: A. Oil retention, B. Return flow, C. High large volume, D. Low small volume. Answer D. Explanation. Small volume enemas along with other preparations are used to prepare the client for this procedure. An oil retention enema is used to soften hot stool. Return flow enemas help expel flatus because of the risk of loss of fluid and electrolytes high. Large volume enemas are seldom used. Question 149. The nurse is most likely to report split finding to the primary care provider for client who has an established colostomy. A. The stoma extends 1.5 inch above the abdomen. B. The skin under the appliance looks red briefly after removing the appliance. C. The stoma color is a deep red purple. D. An ascending colostomy just delivers liquid feces. Answer C. Explanation. An established stoma should be dark pink, like the color of the buccal mucosa, and is slightly raised above the abdomen. The skin under the pliant may remain pink or red for a while after the adhesive is pulled off. This is from an ascending ostomy, and very liquid, less so from a transverse ostomy, and more solid from a descending or sigmoid stoma. Question 150. Which goal is the most appropriate for clients with diarrhea related to ingestion of an antibiotic for an upper respiratory infection? A. The client will wear a medical alert bracelet for antibiotic allergy. B. The client will return to his or her previous fecal elimination pattern. C. The client verbalizes the need to take an anti-diarrheal medication PRN. D. The client will increase intake of insoluble fiber such as grains, rice, and cereals. Answer B. Explanation. Once the cause of diarrhea has been identified and corrected, the client returns to his or her previous elimination pattern. That is not an example of an allergy to the antibiotic, but a common consequence of overgrowth of bowel organisms not killed by the drug. Anti-diarrheal medications are usually prescribed according to the number of stools, not routinely around the clock. Increasing intake of soluble fiber such as oatmeal or potatoes may help absorb excess liquid and decrease the diarrhea, but insoluble fiber will not. Thank you for watching.